Good. You guys all good? Good. Let's do it.
All right. So thank you so much for being on today. We appreciate it. We are going to give a few situational updates, and then we will turn it over and ask questions, and we'll answer those questions for you. So first of all, in the state of Wisconsin, as of 1 p.m., we have 206 confirmed cases, and we have 2 deaths noted in Fond du Lac and Ozaukee counties. In La Crosse County, we did add 1 case, and we now have 5 lab-confirmed cases. The added case today is in one of the previous households of ones that we had previously talked about, so we still do not have community spread. We have that individual was in her lower 20s and is a female, and again was in one of the households where there was a previously lab-confirmed case. We also want to note to the public that we are opening a call center, and that is already live, and we're doing that because we want to make sure that individuals who have questions have someone they can call and they can get their questions answered. So we currently have a number of people that are taking calls, and this can be anything from, what is my risk level to, do I need to go call my healthcare provider, or do I just need to stay home? To include, I'm a business, I don't know how I'm supposed to be responding to a potential positive case in my business if that happens, to I'm a child care provider, or I'm a salon, to, I have concerns about anything else. So we want to be responsive to our community members, and that number for the call center is 608-785-6240. 785-6240. A couple other items I want to note here as making sure that our residents are looking at valid sources for information. So in particular, we're talking about the lacrossecounty.org/COVID-19 website. In addition, the Department of Health Services or the Centers for Disease Control or CDC websites are valid sources for you to be looking for good information. Also, I want to note people with mild symptoms right now, we want to say the message of staying home is so critical, because we do have information showing us that those with mild symptoms are part of causing the spread of this across our country. So even if you don't have severe symptoms and you don't feel terribly ill, again, we just want you to stay home if you are not feeling well in any way. And lastly, most importantly, you do not need a test to help you know what to do. We've already mentioned, if you don't feel well, you should be home. We want you to be home if at all possible right now, because again, we don't know exactly where we can pick up this virus, and we want to be making sure we're reducing the spread. So we don't need a test to know what to do. There are individuals in our community who we will risk assess and determine if they need a test. But many people call us and say, how can I go about getting a test? And not everyone needs one. And again, if you get a negative test result, that doesn't clear you from being in a 14-day quarantine period, for example. So with that, I'll let, from Mayo here, Dr. Mulling, let us know if he has any updates, and then we can take questions.
I guess you covered it very well, Jen. I mean, this continues to be a pandemic, and we're in the midst of it. So I would let you guys ask questions. I'll do my best to answer them to my ability. So
great. Okay. What questions do you guys have?
Maybe first your reaction to Governor Evers deciding not to mandate in-shelter.
Not to mandate, sorry, I didn't hear it.
The in-shelter rule.
Oh, yeah. So again, I think these decisions have a lot of pros and cons to them. And I'm grateful that I'm not in his position. He has a lot of power and authority and a lot of things to consider. I think that doesn't change what we are telling individuals, and that is that if you can stay home, you should stay home. We see a lot of local businesses and even the county included choosing not to be open to the public for walk-ins and doing business differently for a reason, because we want to continue to send that message of don't be out and about if you don't have to be. The more you can be home right now, the better.
And then, Doctor, is Mayo setting aside any kind of space for quarantine inside the hospital at this point?
quarantine as far as where the patients that are admitted to the hospital are truly patients that need to be admitted to the hospital. Once those patients are admitted, they are quarantined to certain places in our hospital, our infectious disease rooms. They call them negative pressure rooms. They're placed into those, and then we have designated. In many situations like this, we're trying to get ahead of what if. We're communicating with Washington State, we're communicating with New York, and learning from what went well, what didn't go well.
Absolutely. Are you putting any kind of travel restrictions on your healthcare workers as well to kind of limit that?
Yeah, that was implemented almost 2 weeks ago.
Awesome.
Kind of right now, for people who think they need to get tested, what's your criteria if they've had direct contact with someone who is experiencing symptoms?
So the question was, for those individuals who have been in contact with an individual, it comes down to if they've been in contact with COVID, they should be quarantined. Now, if they are experiencing symptoms, do they need to be tested? I can speak from the fact that I've had people that have been in contact with them. My recommendation is quarantine yourself. You probably have it. Stay home, where you should be, and do not be out in the public spreading it. If you're asymptomatic and you're just out in public and you think you have COVID, for whatever reason, really looking at fevers, cough, the symptoms of it to be tested.
Related back to some of the patients who do have COVID-19 who've kind of come in, are you assigning certain staff to those patients, just those certain staff to kind of help with that?
Yeah, we call them PPE, personal protective equipment, and they're doing that appropriately. Obviously, you try to limit the number of staff in contact with those individuals. So yes, that is occurring. Obviously, shift work, and as you have to change out, there are multiple staff members come in contact, but they're using the guidelines for caring for those individuals.
Absolutely.
I know we have 5 confirmed cases now in La Crosse County. Is this the pace you anticipated? Is it slower, faster spreading?
I'm grateful that there are only 5, and we're literally talking about 3 separate households. I am grateful for that, and I don't know that I expected it to be faster or slower. Again, I think projections right now are really likely to be not accurate, and so I think we're grateful to see that there are only 3 households currently that have experienced COVID-19 from a lab confirmed standpoint, and that all of them do not have severe symptoms, have not required hospitalization, and that we do not have any deaths in our county.
I reiterate that, and just, is it a sign that we're doing a good job of doing what we're asked to do, stay home, shutting down our schools, shutting down our workforces, our employment? That's to contain this, and it's too early to tell if that's why we're only seeing 5. I too am happy that we're only seeing 5 at this time.
And I would just add too, whether we know for sure or not, if that's because everyone is trying to play their part, we know that is helping. And so this is evidence that we need to continue to do those things, if not at the same level, more.
What activities are safe for people to do over the weekend?
So I would say activities that you can do inside your home, in your yard, where you are not in contact with large gatherings over 10. If you want to be outside getting some sunshine, if that is available to us this weekend, that is very important for our health. Doing things that help you reduce anxiety, helping you to stay calm, being within your household and spending quality time with your family members or your pets. Those are all wonderful things to be doing this weekend.
What is the county considering community spread? I mean, wouldn't the positive cases be considered community spread because they don't know kind of how or when they picked it up?
So that's a good question. The question is, with the cases we currently have, how do we know they're not community spread? We know that because we do disease investigation. We speak with these individuals and we find out if they have a travel history, and that has been the case with all 3 of these households that are currently experiencing COVID-19 cases. So we know that those are not community spread, because community spread is when we cannot determine a source of exposure.
Absolutely. And then is there any kind of people that are being tested right now who have alerted the department in terms of showing symptoms but not necessarily having contact with some of the individuals that tested positive for COVID-19?
Yeah, so we are currently, the healthcare systems are testing individuals based upon risk, and we have a number of tests that we're waiting on results for. We have a number of tests that we received negative results on, and we contact those that have negative results and let them know they need to remain in quarantine or isolation if that's what they already were told, because again, the test does not clear them from risk. So yes, we have a number of tests that we're waiting on results for.
And I know you've kind of brought up community spread and the social distancing quite often. How might this type of community spread accelerate with the number of cases locally?
So, currently with only those 3 households that have lab confirmed cases, this goes back to the contact tracing and the investigation that we do with those families, because they do have a higher risk of spreading to others than others in the general community. So we find out who they've been in contact with, and we notify anybody who is potentially exposed. We give them the same strong recommendations that they be in quarantine if they're not ill, and if they are ill, that they be in isolation, and we help them determine if they should or should not go in for testing.
Absolutely. And when do you feel as though you'll be confident saying that the ongoing risk to community spread is pretty low?
So the question is, when will I feel confident that the risk to the spread in the community is low? I think it's too early to tell when that would be. We continue to see increasing numbers of cases across the state. Again, we know that that's just one way for us to monitor what's happening with COVID-19. We're not at a place yet where we can say that the risk is extremely low, because we do know that there are a lot of people who have traveled that are currently in quarantine or isolation that are currently being tested. So we just have to wait and see and continue to take the precautions that we've talked about.
Do you guys have an estimate of how many tests you think have been given out in La Crosse County since the drive-thru's open?
An estimate of the number of tests in La Crosse County?
I know personally I can't speak to the entire system of La Crosse, Mayo, but at the drive-through center we've done over 200 to 300, well, about 250 I would say.
In total?
In the drive-through in total, yes.
Okay.
We're doing around 50 a day, so we're day 5 into our testing. That's 250 roughly that we've done. And again, far majority are negative, but that doesn't give us a false sense of, hey, it's okay. But as Jen has indicated, we still need to take measures to protect the community, and that's by staying home, not going out in public places, not big gatherings, following the rules that CDC and others have recommended. I will say that testing too, for us, we'll continue testing through the weekend. Same hours, 9 to 6 throughout the weekend. We've been able to secure enough supplies to do testing to those in our community. And then also we've been able to increase the volume of testing that we can do through our laboratories.
And that is by being screened for needing the test and calling
Correct.
first to get that.
Thank you, Jen, for pointing that out. Yes, we still ask people do call. If you're a male patient, please contact your clinic. If not, call our hospital numbers. They will then direct you to the triage line, who then will screen you and appropriately, if need so, set up a testing for you to come through our drive-through.
Yeah, and we have had a couple of calls from individuals in the community that are indicating they are having tightness in their chest and or difficulty breathing. Yeah. This is not a mechanism to replace 911. If you have symptoms that need to be called to 911, you need to utilize that system. This is only for more mild symptoms that we might be seeing, or severe where you feel really sick but you are not having difficulty breathing. If that happens, you probably need to call 911.
Absolutely. They are prepared. They know what to do. They know what's happening, what's occurring. So our EMS staff and our paramedics and our fire departments and police are very well vetted on this, and they'll take the steps precautionary to protect everyone also.
We are routinely meeting with police, fire, and EMS over the course of the week. We meet with them regularly. We discuss what PPE needs they have. We talk about other operational needs, so we're in contact and we're working together really well as an entire system for this community. So we just ask that you do your part and stay home if at all possible.
I think that's it.
Okay.
All good.
There was no Facebook questions?
No, it was.
Pretty quiet? Okay.
Thank you, everyone.
We'll take that as a blessing on Friday.